I'm Cliff Moody, I'm the L&E Route Workforce Health, Safety and Environment Advisor, and obviously we're looking after the workforce health, safety and environment issues. There's lots about, there's occupational health risks really, regarding COSH, working with chemicals, there's manual handling, there's stress, there's hand-arm vibration, there's noise, it's quite a big heavy industry out there. And we've got maintenance guys and girls, we've got operational staff, we've got office staff, obviously we've got external contractors, we've got managed stations, there's public get involved. What brought about all this regarding health and health fairs, one of the guys at Wakefield, he had an heart attack while he was on site, which was quite obviously distressing for him and his family, and all this so distressing for the guys he worked with. When I went and saw his family at Wakefield, Pinderfields Hospital, it really tugged on heartstrings really. It's like, what can we do to guys? What can we offer more support for those guys out there? So, working with colleagues, we came up with the idea of health fair, which is quite a number of workshops. We were looking at people's blood pressure, general health issues. We look at healthy eating habits. We look at cancer. Basically, we've got a lot to do with cancer, and they were coming in doing workshops. We also had the fitness, core strength, healthy exercises, and we also got a firm in called Care First who spoke to guys regarding counselling issues and what offer support we can give us guys. Working with colleagues and external companies, I asked the questions, what kind of support. Basically, I went to the staff first and said, thinking about an health fair, what you want us to talk about. And, we got local gyms involved, we got cancer research involved, we got Westwood involved who giving healthy eating and wellbeing information. Also we got involved with an external company who were checking the guys' blood pressure, BMI, and just generally giving general good health information.
I was talking to the lads I work with and they were a bit apprehensive, but since they've been really fantastic, really positive.
Do you think it'll make a difference to some of them, some changes in lifestyle maybe?
Yes, I think it will, because one of the chaps I work with, he had really raised blood pressure.
That's done very interesting.
The beauty about organising a health fair, if you go to an NHS local, there's a lot of companies out there who will come in and deliver health and wellbeing workshops for free. So basically you need a resource, obviously you need a resource for the 5 workshops or whatever workshops you want to do on the day. You need a resource to keep the day running, your admin costs, whatever. But an health fair generally for Network Rail, it costs anything from £100, £200 to £3,000 or £4,000 for the day. If you get in touch with a local NHS direct and obviously cancer research, Samaritans and people like that who's willing to come and talk about health, then they will come in and there will be a small charge, some charge more than others. But yeah, it's just a matter of picking up the phone and ringing them up because they're so willing to help and support any industry, basically, not just railway industry, in promoting good health and wellbeing. To get the time, the logistics side, and the managers and the line managers for the guys and the engineers and the managers of the delivery units get full support to this and basically give a 2-hour slot for the guys to attend. Staff members who came to these health fairs were split into 5 workshops, healthy workshops. So there were 15 per workshop, so we had 75 attendees in the morning and 75 attendees in the afternoon. I got a regular team and basically sat down with the occupational health specialists at the time and we did a plan, working with us external colleagues who were delivering the health and wellbeing information. We set up a 2-year plan and we've just finalised a further 2-year plan as well. So far we've done 60 health fairs and we're looking at another 40 in the next 18 months. At the moment it's more maintenance staff and office staff and works delivery guys, but we're hoping to push it out into investment project teams and as operational colleagues as well over the next 2 years. The response from the health fairs from the colleagues has been absolutely fantastic. We've had some really positive feedback in regards to how it's changed their lives. Really, they've started looking at the diet, the exercise. We've even got guys now that went out and bought a dog, and I'm doing 3 or 4 mile a day. So and he's lost 3 stone by just doing that. My job title, HSE, health is as far as important as both S and E's really, and it's a long-term project. It isn't one of them overnight it's out here, gone tomorrow. You know, this is a long-term project. The guys out there, they're doing the business. It's important that, you know, that we offer them health support and well-being best we can. We've had quite a lot of leg pulling between the younger guys and the older guys, but to be fair, all ages, all sexes, they've all embraced it and really took it forward. They've been brilliant. The future, I was obviously, you know, we'll keep rolling them out, but we need to listen to guys out there, and whatever they want, you know, we'll evolve, we'll change, we'll listen to them, and new health issues may come up, so we'll address it, but we'll keep moving and listening to the guys. What we can do to support other companies and as colleagues, you know, apart from Network Rail, obviously if they contact Chris Jones or myself, Cliff Moody, then I'm happy to share the practice. They're more than welcome to attend an health fair which is planned, you know, they're planned over the next 2 years.
Cliff Moody from Network Rail talks about the benefits of running health fairs. A lot of the TOCs also run these health fairs and they're quite popular, and it is an opportunity to put out good quality information and engage with staff, talk about what their health needs and issues are. A lot of professional organisations will contribute to a health fair, so there is a lot of collaboration between companies that can be fostered, and good information found to those people who want it. And as you've just heard, Cliff is very happy for people to contact him to share on how he's gone about organising health fairs.